Awesome. Hi everyone. This is Panos, co-founder of PNOΗ, and I'm here together with Cameron in New York City over at Bespoke Treatments. Bespoke Treatments is a physical therapy and performance optimization center in New York City. They've been with us for quite some time now. One of our best performing affiliates, been working with many different types of clients, and together today with Cameron we're going to be discussing some of the most interesting use cases they've seen and more about how they use the PNOΗ metabolic analyzer in their practice. So Cameron, thank you so much for your time.
Thank you.
Doing this with me today. You guys have a wonderful facility here.
Thank you.
First of all, we would love to learn more about the type of work you guys are doing here in general, then what kind of biometric screening you're doing, how PNOΗ fits into the picture. You get pretty much the gist of it.
Yeah, absolutely. So again, thank you for having me today, and thanks for coming over and checking out our space. So again, my name is Cameron. I'm a doctor of physical therapy and a strength and conditioning specialist. So kind of all of our physical therapists and all of our strength and conditioning coaches here, we like to make sure that we can take clients from they can just be fresh out of surgery, and really our role, it's really exemplified through our ethos that you see here, to live better longer. Our goal is not to just get them back to baseline, but really make huge health improvements in all physical qualities that they have. So whether they're coming out of surgery, they have just some chronic aches and pains or some chronic illness, we can find either what's just limiting them and give them a boost, or just perform or just improve all of their physical qualities. So over here, generally fit clients into 3 different categories. So first one, this would be the bulk of our clients, is those who are looking to improve their health.
Mm-hmm.
And we have a lot of different ways of testing and measuring and assessing what specifically they need to improve to give them the biggest bang for their buck.
Mm-hmm.
These are going to be clients that, again, are coming out of surgery, for example, have a new injury.
Mm-hmm.
Maybe they're just deconditioned, as a lot of the American population is, or they have some chronic illness, again, which a lot of the American population does have.
Mm-hmm.
So with these clients, our goal, again, isn't just to get them to a baseline, but really get them as healthy as possible. And that's
Mm-hmm.
really our starting point with everyone.
Mm-hmm.
We have some clients who come in here purely for fitness improvements.
Mm-hmm.
These are going to be ones that they might have some aches and pains, but for the most part, these are clients that they have some training history already under their belt, but there's a lot of room for improvement, whether
Mm-hmm.
that's improving their mobility, improving their strength, or improving their capacity, which PNOΗ really comes into play. And then we have some clients, the high performers, where my job is not really to interfere with their already high levels of performance, and really just figure out what is holding them back from their true ceiling.
Mm-hmm.
And so with that, I'm pretty hands-off. It's more of a consultation role,
Mm-hmm.
where I want to see exactly what's holding them back, and then give them optimization. And again, that's where
Mm-hmm.
PNOΗ really shines,
Mhm.
is I can see exactly where in their physiology
Mm-hmm.
they have these limitations. And if we just target that, we're going to see kind of the whole system reorganize and give them a big bump there. So.
No, definitely.
So the PNOΗ really fits into kind of all of those domains. If it's more of a client looking to improve health,
Mm-hmm.
what I really want to do, especially if they're coming back from an injury, is really
Mhm.
boost their aerobic system.
Mm-hmm.
That's really going to help with their recovery. If it's a fitness, I'm still going to focus a lot on their aerobic system, but I really want to give them a broad variety of kind of all training intensities. And
Mhm.
again, I can see with the PNOΗ, with the reports and the platform, exactly where all these intensities are. And then with the performance side, again, I can just focus on their
Mhm.
limiters.
Mm-hmm.
And we'll combine that with a lot of other different measurements. So we use force decks,
Mhm.
we use a lot of muscle testing,
Mm-hmm.
so we can get quantify exactly where their deficiencies are, but also make comparisons side to side.
Mm-hmm.
We use 3D motion capture, and one of the biggest pieces of equipment that I like to use is actually tracking through the biostrap, their HRV, the resting
Okay.
heart rates,
Cool.
and all of their resting metrics, because
Okay.
those are also going to be influenced by their training.
Mhm.
Whether that's making sure they aren't overtraining or just making sure that they are making progress. We'd obviously expect to see their HRV improve, their resting heart rate, as well as their respiratory rate. We'd like to see all these improve with their training. So that's how we utilize PNOE with kind of the entire spectrum of our population.
Okay, this is awesome. Another question we typically ask our affiliates is, in PNOE's mind, in our mantra, there's 3 basic pillars for performance and longevity, which would be performance, in other words, training, nutrition, and then recovery. These are, we would say, the most powerful levers when it comes to optimizing one's health and performance. In terms of the first group of people that you described, so the ones who are, generally fit, but their main objective is to remain fit for the remainder of their lives, right? And, keep chronic conditions at bay. Out of the 3 pillars, what would you say is the biggest pain point? Like, in which area would you say people have the most questions? And where do you see yourself adding the most value in terms of these 3 pillars?
Yeah, that's tough because where I can add most value is always through movement and always through exercise.
Okay.
That's my bread and butter. I'm both a physical therapist and a strength coach, so I can cover this entire spectrum of human movement. But like you mentioned, nutrition is such a big piece of both recovery and performance. And that's the trickiest part for me, because that's a bit out of my scope. I don't focus as heavily with them. So that's kind of where my relationships come into play. So I've got a lot of different relationships with both different organizations and individuals where I can say, based on how you're looking, for example, in your RMR report, where your fuel sources are, where your calories are coming from, I think this would be a great dietitian or nutritionist for you to work with. Or I want you to monitor, because I'm a little bit concerned that you might be on the path to pre-diabetes. I might want you to get into more glucose monitoring.
I see. Interesting.
So that's where because I fully agree with you that the nutrition is almost like the base layer, and it has to be there, especially for recovery. The protein demands that you need when you're coming back from an injury are very significant, as well as the total calorie demand. So that's where relationships really come into play, and that way I can focus on my strengths, which are going to be improving their movement and their performance.
That makes a lot of sense. Awesome. So, in terms of success stories and perhaps use cases you would like to share with us, can you talk a little bit about clients where you had the opportunity to identify a limitation with PNOE? What was then the program that this person received in terms of recommendation based on the limitations that were observed from the test, and then what was the outcome a few months after this intervention was applied?
Yeah, so again, 3 different kind of broad categories I fit people in. One in particular, because our primary fitness population that comes in, people who are, again, they're not necessarily any big health concerns underlying, but this population, they're mid-30s to mid-50s, so getting in that middle age where if you're not careful, we see a lot of physical qualities decline, we see health overall decline. That is that age where your age just starts to show if you're not careful. So one client in particular, in his mid-40s, male, and training on his own, has a bit of a training history, CrossFit here and there, weight training just at a gym here and there, running on his own. And this is a pretty common client that we'll see where they want to improve their fitness, but they just don't have the direction. Life has kind of just gotten complex at this age, and they can't focus as much on their own training, and so it's just kind of, I'll go to the gym and I'll kind of do whatever. So pretty common. So first thing we'll do with any fitness client is we like to do both the RMR and fitness test, just to get a baseline. So with this client, first thing we did, RMR, we see about a 50-50 split in their fuel sources. I'm sure that's a pretty common finding.
Quite common. And then obviously it's interesting that when we look at RMR tests coming from states that have higher prevalence of diabetes or pre-diabetes, we're going to see these RMRs showing up with more predominant carbohydrate oxidation for the most part. When it comes to facilities that would typically deal with people who are not severely unhealthy, but would be categorized as healthy overall, but still a few things to fix, then showing up with a 50-50 split in your fuel sources in your RMR is quite common.
Yeah, so I figured, I sent him a training history questionnaire. I sent him a questionnaire kind of focused on what his diet looks like, and it really just became clear. He does a little bit of resistance training here and there. He's probably just going out for a hard run for 30 minutes, whatever, here and there. So didn't inquire yet on what his diet was like, but it was pretty clear from that I'm going to see that he's probably not the most aerobically developed. His aerobic capacity is probably pretty low, and he trains probably in that sweet spot. I generally find that these people, they do a lot of sweet spot type training. So we get into the exercise test, and I see a huge limitation on pretty much all of his metrics, but especially his cardiovascular metrics.
Okay.
And that's where the reports come into play that I think are really helpful, is it gives you a standard to compare against for the future. So I can purely just look at his platform, but having the reports to just go over a clear comparison with them is very nice. So big limitations in his cardiovascular fitness.
Did this person have any sort of history of cardiovascular disease or?
None.
Okay, none.
Yeah.
Okay.
I really just attribute that to just the type of training.
Deconditioning.
Yeah.
Okay.
So going through his report, going through his goals, because he still wants to do his resistance training. He wants to just get fitter overall. So that's where kind of the health category versus the fitness category comes into play. I'm going to end up pushing the fitness category clients a little bit harder. I'll get more adaptation out of them, and that is going to stress their body a little bit more. And so it sounded like he was doing a lot more sweet spot training and getting into what his training would look like. He wasn't really keeping track of heart rate. Just going to a pretty hard effort and just sustaining it. So what I like to do with them, obviously, is get them out of that a little bit. If that's what you've been doing and you haven't seen huge success, let's try something different. So with him in particular, I wanted to get him into more of a polarized split.
Okay.
So that's where I like to go. If I see people doing a lot of sweet spot training and they're not making huge improvements, I like to get them into a little bit more of a polarized split, just because we haven't been working on that. So I will use the platform in this case, and I'll look at where are their thresholds. So with him, I'll look at where's his aerobic threshold, and we found that was roughly 136 beats per minute, where he gets that top end of that threshold. So I'll give him a lot of steady state work, sub-threshold, with a few touches above that, just so he can still have some fun with it. It'll still feel like he's putting in a hard effort with that. And then I'll also look at his anaerobic threshold and give him some intervals above that too. So with him, he still wants to do 3 days of resistance training. That's fine. We had to restructure a little bit of what that looks like. So that turned into more of 3 days of full body resistance. And then his conditioning days, we focused on 3 steady state days, 45 to 60 minutes. One of those we touched into that threshold right above his aerobic threshold, but everything we're trying to keep sub-threshold to give that boost to his aerobic capacity.
Awesome.
4th day, we're looking at training above his anaerobic threshold.
Okay.
So trained for a good, I want to say 8 weeks there. Came back for a retest. Phenomenal improvements across the board.
I see.
So having that access to his physiology throughout the entire test, being able to pull up where his respiratory problems are, where his metabolic problems are, just being able to visualize everything is extremely helpful. And that's where these reports and the platform can be so powerful. So with him, we retested first one, same thing, we retest his RMR. He went from a 50-50 split to a 70-30 split. So
70 fat, 30
Yes.
carbs. Okay.
Yeah.
That's awesome. That's awesome.
very nice work there. Went from a severe limitation in,
What about his metabolic rate? Like, do you see any increase in the metabolic rate, or was it more or less the same?
metabolic rates. Let me see. Metabolic rates, pretty similar.
Pretty similar, yeah.
Yeah.
I mean, for people that have been doing resistance training for most of their lives, resistance training is the most potent lever for boosting metabolism. So his metabolism was likely already pretty high. A low metabolism wasn't that person's limitation. It was more his cardiovascular and respiratory systems that required work. So it's actually quite expected that metabolism will remain the same. But you know, obviously, switching from a 50-50 split to a 70-30 split, where you're burning significantly more fat throughout the day, that is going to help you a lot, both in terms of cellular health, but also in terms of cutting.
Yeah.
End of the day, right?
Yeah.
Yeah.
And that's a big piece, you know, even if people are coming to me for performance, for fitness,
Yeah.
it's in our ethos that
Yeah.
health has to be a piece of it.
Absolutely.
So
Yeah.
I'll have some people that they come to me, they lift weights 6 days a week,
Okay.
and they just want to know, you know, how can I lean out a little bit easier?
Yeah.
And so when I look at their split for their RMR, you know, they might be doing 10% fats to 90% carbohydrates.
Okay.
Just
I
because
see.
they're lifting every day, their
Yeah.
diet is
No capillary density whatsoever.
yes,
Yeah. I see.
very heavy with the
Yeah.
carbohydrates because they want so much glycogen.
Yeah.
They have a lot of muscle mass, and so I tell them, you know, I'm like, you know, I understand your goals,
Yeah.
but we do have some improvement that this is going to promote longevity so that you can do this for longer. So regardless, that RMR test is extremely powerful.
That's awesome. Now, in terms of the physiological and the psychological impact that the test has on the clients, can you talk a little bit more about that? Obviously, I can understand how the test, from a physiological perspective, is quite valuable because it reveals to us what is happening under the hood, and therefore we can be more effective in terms of prescribing a nutrition, a training, whatever plan. But can you talk to me a little bit more about the psychological impact that you have seen these reports having on clients, and how exactly, like, what is the aha moment? How do you actually see the switch changing in their minds when they actually see objective data in front of them?
Yeah, that's where the objective piece is really what changes it, because if everything is more of a qualitative metric, it can be very hard for someone who's very stuck in their ways, who likes training a certain way, or who might not be bought into your programming for them to come around.
I see.
So
Do you see that often? Like,
all the time.
all the time. I see.
Absolutely.
A lot of people who, you know, come for help, the oxymoron is that they are still pretty stubborn about their own ways, right?
Yes,
Yeah.
yes. I'm doing it this way, this is how I
Yeah.
like to do it.
Yeah.
But you're not seeing progress here.
Yeah.
So yeah, that's one of the most powerful things is, you know, when I, you know, a little bit tangential, when I see someone who has an injury and I take them through quantifying isolated joint strength in every single muscle group or muscle individually,
Yeah.
and their knee pain is coming from a problem at their opposite hip,
Yeah.
you know, if I just told them that without quantifying it and showing them the results, there's going to be some skepticism.
Yeah.
It's going to be a little bit harder for them to buy in.
Okay.
So when I can show them exactly, I'm like, this is your physiology when you're training, and they can see it clear as day, they're like, okay.
Tell me what I need to do.
I get it. Let's do it.
Okay.
And that's also, you know, how the reports can just be so powerful is, you know, they can see exactly, these are based on norms and these are based on your own physiology, and this is how you stack up.
Yeah.
Clearly there's a problem here,
Yeah.
you're doing this, I understand you like doing this, we'll
Yeah.
still get some of that in your program, but if we want to improve this,
Mm-hmm.
we need to train like this.
No, totally.
So the psychological, that often comes from recognizing
Mhm.
the quantified physiological.
Okay. No, this is something that we've seen a lot, and we always try to get our affiliates to talk about that because it's obviously essential to be sharing feedback. Now, in terms of specific types of training, for example, breathwork or training in specific training zones, what type of work have you guys done in this direction with your clients?
So when there are clients coming back from an injury,
Mhm.
for example, ACL injuries,
Okay.
very common injury, what we often see is fatty infiltration into the muscle tissue. We see the muscle tissue as in itself has a lot of mitochondrial dysfunction, and it just gets extremely hard to put on muscle mass after these injuries, especially the ACL as it relates to the quad.
Interesting.
So with these clients, and I'll just use,
Sorry, just for me to understand that better, the ACL injury leads to lesser ability to build up muscle in the quads, for example.
correct,
Okay.
yes, and that
And that is because of basically fat infiltrating the muscle.
there's a lot of different reasons.
Okay.
It can get pretty complicated.
Okay.
When it comes to actually the mitochondrial dysfunction, why that happens, it's a little bit of a mystery.
Interesting.
But some of it intuitively does make sense that it's been immobilized for a while. There's been an insult. When there is an injury, the body does have this autogenic inhibition where it does shut down certain muscles if there's a certain amount of fluid in the joints,
Interesting.
just as a protective
Okay.
mechanism.
Okay.
But we also just see some metabolic changes, nervous system changes, where even the innervation is slightly different.
So, have you seen that people post some sort of trauma or injury show up with significantly deteriorated fat burning capability and perhaps higher RER across the board from a resting state to all of their exercise states?
Yes,
Okay.
though I have a lot of these types of clients,
Okay.
it's very rare for me to have seen them before the injury.
I see. Okay.
That would be
Okay.
great if I could capture that
Yeah.
before,
Mm-hmm.
but
Mm-hmm.
a lot of these clients, they're otherwise healthy.
Mm-hmm.
So I can, reverse engineer and think back that
Yeah.
this probably wasn't a problem
I see.
before.
I see.
So they do get some local metabolic changes within the affected area.
Mm-hmm.
And so that's where their lower aerobic work really comes in. So any upper body work, I'm going to have them do a lot of lower intensity, kind of again, sub aerobic threshold work for their recovery to build up that mitochondrial density, that capillarization within the injured
I see.
area.
Cool.
So that's where a lot of that lower threshold work comes in if they're coming off an injury.
Okay.
Yeah.
Super interesting. What is the most common injury that you guys treat here in terms of, athletes or even like everyday people?
Everything orthopedics.
Okay.
So a big amount of, I would say our highest proportion is going to be knees and shoulders,
Okay.
closely seconded by lower back, which
Okay.
afflicts everyone in some way.
Totally.
Just when it gets to a level that people seek help, that's where they come to us.
Have you seen any correlation between people having lower back issues and having a low score in their respiratory metrics? For instance, respiratory capability or respiratory capacity, basically how big their lungs are and how effective they are in utilizing their lungs.
Yeah, so a big piece of people who do come in with some lower back pain and we'll say some movement dysfunction around the hips or their trunk as a whole is they have a really hard time articulating their pelvis independently,
Okay.
their spine segments independently.
Okay.
And we know diaphragm attaches towards the lumbar spine, a lot of the hip musculature attaches to the lumbar spine. So if they can't get into either lumbar flexion, lumbar extension, anterior tilt, posterior tilt of their pelvis, they're not going to be able to breathe effectively. So that is 100% very common. There's plenty of research just showing, and this goes with pain as a whole, as you see altered motor patterns. When there is pain, it's just, the body's going to look for different ways of moving. And the torso is an interesting spot because, we do have our diaphragm that attaches there. So we're going to see altered breathing patterns as well. Usually going to tend towards, because they have a little bit more stiffness, they are a little bit more protective tone in the area. And so what we'll see is they don't like taking bigger breaths. So capacity is definitely going to be down there, and they obviously still need to oxygenate, so we're going to see frequency increase with that. So that's very common with low back, any low back dysfunction.
This is quite interesting. And now something else that is becoming quite popular amongst PNO‍ය affiliates, but outside the PNO‍ය community as well, is this intersection between brain and breathing. We know from science that our breathing apparatus is one of the most potent levers of how oxygenation is delivered to our brain. And so people that present with some sort of respiratory dysfunction will also have some sort of propensity towards lower brain oxygenation. So since you guys are seeing so many clients, my next question would be, have you guys seen any sort of correlation between people scoring low in the respiratory metrics, either in the resting or the exercise report, and then at the same time having propensity towards either anxiety or either loss of focus, migraines, anything that would have to do with the brain?
That's a very interesting question, and one that I haven't actually fleshed out enough now that you mention it. I do see, and I don't know if it's a relationship, but there certainly could be one, obviously, because that's so important with oxygenation of the brain. But we do see a trend, and I think this is globally in clients who do have more anxiety and depression, generalized anxiety and depression. And so anxiety in particular, as that can kind of spiral, we are going to see things change within their breathing. That isn't something I've measured, but I do go over specific breathing strategies with these clients. So it would be very interesting to test these clients and see, can we actually make this improvement, slow down their respiratory rate a bit, to improve their volumes a little bit, and see if we can make any change with their anxiety. And just like we talked about earlier with the psychological side, if we quantify this, can we maybe get a little bit more buy-in with these breathing techniques?
And since you're mentioning breathing techniques, can you name a few, like what are the most usual ones that you put in practice, and what are the conditions that you use these for?
Yeah, so the biggest one, and this is going to be a piece of recovery, is really just diaphragmatic breathing. But getting them into a better position for it. Because a lot of people will end up lying supine, and they already have a skeletal structure or just a certain muscle balance where their rib cage is facing one way and their pelvis is facing the other way, and they just can't take effective breaths even if they try. So it kind of turns into just another dysfunctional breathing pattern, if we want to call it dysfunctional, maybe just not optimized. So a big piece of what I do is show them how to get their ribs under them, how to get their pelvis under them. Take full 3D expansions of their rib cage, getting their rib cage to expand, getting their lower back to expand, just full use of their diaphragm on both the inhales and the exhales. And the amount of volume change that they can get with that is significant. Beyond that, I'll move them to alternate nostril breathing. It's just a focusing technique, a centering technique. And with that, I'm still getting them in the same position to improve their use of their diaphragm, their rib cage, and their pelvis.
That makes sense. Breathing training is such an important thing, and you can improve so many things in your life just by learning to engage your diaphragm and using your nose in many cases. It's just a very simple thing that can have a very big bang for the buck for a lot of people. Awesome. All these insights were great. I don't know if you have anything else you would like to mention in terms of clients, PNOE, your practice, any comments in general.
Yeah, well, what I can say is my practice really has transformed after starting using the PNOE platform and the reports. Both from my own knowledge, I can see so much in their physiology that I just didn't have access to before. I can make assumptions based on how they're performing, and then just kind of go backwards and say, this is probably an aerobic capacity limitation. This probably has to do with their fuel sources they're taking in. This might have to do with stress. But now being able to see everything, it's just really transformed practice. So the platform, the reports with the essentially getting them buy-in on their entire program, it's been extremely powerful and it's really been transformative.
Awesome. Well, it's obviously great and an honor to have you as an affiliate, and obviously we look forward to doing more. And thank you so much for your time.
Yeah, absolutely. Thanks for joining us.